Hi, my name is Jasmine. I'm a Butler nursing student. I'm going to be completing my CPE for med administration. Right now I'm in my medication room. I'm going to grab my supplies. I'm also going to grab my medication and have it prepared to go into the patient room. Now the patient has been prescribed morphine sulfate, and so I'm going to grab a syringe here. Since it is 0.125 milliliters of morphine, I'm going to grab a 1 milliliter syringe. That way I can get to that exact amount of medication the patient needs. Okay, and so I'm also going to go ahead and label it here. So I have the 2 milligrams per milliliter, and then I have my medication of morphine sulfate also. So I'm going to perform hand hygiene. Put some gloves on. Now, normally with morphine vials, you cannot insert air into that, so I'm going to take that into account when I get my medication out. I'm going to grab an alcohol swab. I'm going to clean it for 15 seconds. I'm going to go ahead and uncap my syringe, and I'm going to pull out the 0.125 milliliters. I'm going to pull out a little bit more. That way, if there's any air bubbles, I can just push out the excess. So I'm going to go ahead and push out the excess, make sure there's no bubbles. Perfect. Okay, now I'm going to do the safety recap, and I'm going to grab another normal saline syringe. Since this does have to be diluted, I'm going to grab a 6 milliliter syringe since it has to be diluted, and pushed over 5 minutes. So this is my 6 milliliter syringe. I'm going to go ahead and move my sticker onto this syringe of normal saline. I'm going to push my medication in here. After I've pulled the plunger, put the excess out, that way there's no pressure. And then I'm going to push the syringe up to the 5 milliliter mark. That way I know that I push 1 milliliter per minute. Perfect. I'm going to go ahead and cap it. I'm going to grab some alcohol swabs, and then I'm going to grab my normal saline syringes also. And then I'm going to grab my morphine since I have to scan this in the patient room. Okay, so now I'm going to enter my patient's room. Since we are in COVID times, I'm going to have my mask on. So what I'm going to bring with me are my alcohol swabs. So I'm going to bring 3. I only have 2, but for the purpose of actually being in a hospital setting, I'm going to take 3. I'm going to bring my medication with me so I can scan it. I'm going to bring my labeled diluted medication syringe here, and then I'm going to bring the 2 3 milliliter normal saline flushes. So I'm going to put that all in my pocket. Okay, and I'm not going to throw. Good morning. Hi. My name's Jasmine. I'm going to be your nurse today. How are you, Allison? Good? Awesome. Okay, Allison, I'm here to give you some pain medication. I heard you were having some pain, right? Yeah? Can you rate your pain from a level of 0 to 10? A 6? Okay. So let's get you that pain medication, okay? I'm going to ask you a couple of questions first. I'm going to perform hand hygiene here. Perfect. Okay. All right. I'm going to go ahead and log into the MAR. Also make sure I have the right patient. So here I see I have Allison Smith, her birthday, and her weight, her allergies, the time, and then the medications I'm going to give. All right, Miss Allison, I'm going to go ahead and check your bracelet here. And can I have your first and last name? Allison Smith. Perfect. And what's your birthday? 5/30/2000. Awesome. Okay. And you're 6 years old, right? Yeah? Awesome. Okay, Miss Allison. So like I said, my name's Jasmine, and I'm going to be giving you some pain medicine since you're in quite a bit of pain today, okay? Okay, perfect. Okay, Allison. I'm just going to go ahead and scan your bracelet here. Make sure I got the right Allison, okay? Good. All right, and so I have my EMR pulled up. I have the right patient. I'm going to go ahead and put some gloves on, okay? I have your medications right here. So I have my supplies here. All right. And Miss Allison, do you have any allergies that you know of? Sulfameds? Okay, good. Kind of depends if the patient patient would know that since she is 6 years old. If not, I would just ask the parent if they have any allergies. And I would just do a cough reference and check that the MAR states the same thing. And it does. She is allergic to sulfa medications. But since the patient is getting morphine, there's no contraindication to that medication being given. Okay, so I'm going to go ahead and grab my scanner. I'm going to scan the patient's bracelet. I'm going to go ahead and scan the morphine. I'm going to scan my flushes. Perfect. Okay, now I have my medication here. And then I have my 3 alcohol swabs. Go ahead and pause it. Okay, now we're ready to administer the medication. So I'm going to perform hand hygiene, put some gloves on. I have everything scanned already. I'm going to just double check the dose again, the 6 patients' rights of medication. So right dose, we have the right routes, which is IV, we have the right patient, we have the right time, we have the right documentation, and so we are ready to give this dose. Also, we have the right dilution. So we have our syringe right here. So the first flush that we're going to give is for patency of the IV site. We're going to check to make sure that there's no inflammation, phlebitis, redness, pain, swelling, anything like that. So that's what our first flush is for. So I have that ready. So I'm going to go ahead and explain to my patient what we're going to give, what we're going to do, and all that good stuff. All right, Miss Allison, so I'm ready to give you this medication, okay? So what you're going to feel is a little bit of coldness, okay? And I'm going to hang out with you for about the next 10 minutes while we give this medication, okay? Perfect. Okay, Miss Allison, so I just want you to be aware, as well as your parents, since they are here with us, of some side effects that you may experience. And if you experience any of these side effects, please let me know, okay? So you might experience some dizziness, and that's normal with this medication. If you're very, very dizzy, you let me know, okay? That's not okay. We want you to make sure that we're not having you get too dizzy. Now, with this side effect occurring, you might be at an increased risk for falls. So if you need to get up, have your mom or dad help you, or go ahead and press this call light right here, and I can help you get up and walk, okay? And then you might experience some nausea. So you might feel a little bit sick to your tummy, and that's normal also. Just let me know if you do experience that, and maybe we can get the doctor to prescribe you something to help with that. Now, you may feel a little bit of constipation. That just means you can't go to the restroom, you can't go number 2. So you give me a call, and we can get something figured out for that as well. And so with this, the most important side effect that I want you to let me know, and which I'll be checking too, is respiratory depression. So what that means is that your breathing just slows down with this medication, since it is a pain medication. So I'm going to just be checking on that on your monitor, and if you feel like you're having a hard time breathing, you let me know also. That's not normal. Okay, Miss Allison, are you ready for us to give you this medication? Good. Excuse me. Okay, so I'm going to go ahead and grab my alcohol swab. I'm going to scrub the port for 15 seconds. I'm going to go ahead and unclamp it. And I'm going to pull my normal saline syringe of 3 milliliters. I'm going to push it down, and I'm going to push up the excess pressure. And I'm going to go ahead and push that 3 milliliters in. Okay, Miss Allison, I'm going to push this a little bit slow. I'm just checking your IV site. Make sure you don't have any swelling, any pain, anything like that, okay? We want to make sure this IV site is good. Any pain? No? Okay. All right, good job. Now I'm going to go ahead and clamp it too. Now, we're going to go ahead and push this medication. Since it is kind of a big vial of medication, also that's diluted, I'm going to push it over 5 minutes, okay? Okay, good. So I'm going to go ahead and grab a new alcohol swab. I'm going to go ahead and clean for 15 seconds. Very good. I'm going to go ahead and make sure there's no air in here, and I'm going to unclamp it, and I'm going to just check my clock, make sure I push it over 5 minutes. So I'm going to push about 1 milliliter per minute, not stopping in between. So I'm going to just push slowly for 5 minutes. Are you okay, Miss Allison? Good. Okay, so let's say 5 minutes has passed. I'm going to go ahead and clamp it. All right, Miss Allison, that was your medication. I'm gonna do one last flush, okay? Make sure everything is in there and not just hanging out in this tube right here. Okay, so I'm gonna grab my last alcohol swab. I'm gonna clean the port again for 15 seconds. Also, when I'm cleaning the ports, I wanna make sure that I don't drop my port onto the patient's gown or on the bed, because this could be a risk of infection. So I want to make sure I'm holding the port also as I'm cleaning and not letting go of the port. Okay, 15 seconds has passed. I'm going to grab my last normal saline syringe of 3 milliliters. I'm going to go ahead and retract it, make sure there's no excess pressure in there. Now for my rate of administration for this normal saline, the first milliliter is going to be pushed over the same rate, so 1 minute, as my other one for the medication. So just to be safe, I'm going to push all 3 milliliters over 3 minutes. So I'm going to go ahead and unclamp it and push my medication. Okay, so 3 minutes has passed. I'm going to go ahead and clamp it to positive pressure. So it's clamped as I'm pushing. All right, I'm going to just make sure there's no tenderness around the IV site. Everything looks good. How did you tolerate that, Miss Allison? Well, okay, so you'll get to feeling better in about 30 minutes, okay? I'm just going to check up on you in about 30 minutes to an hour. Make sure that your pain has subsided, and I'll grab your pain rating again at that time, okay? Okay, good. Okay, so now that we're done with the medication, I'm going to go ahead and dispose of my materials that I used. I'm going to document this in the MAR now. Okay. Now I'm going to document the patient's how she tolerated this procedure. I'm going to document all the necessary information. Now, I did take vital signs before I administered the medication, especially respiratory rate. Since this is morphine, it could decrease that respiration. So I wanted to make sure that we grabbed a baseline of her respiratory rate, which we did. It was given in this scenario. And now I'm going to document that information in here. I'm also going to document the amount of flushes that we used, the dosing of the medication, how she tolerated the procedure, and I'm going to make sure that everything is on here documented well. Now, I am going to check in about 30 minutes to an hour to make sure how the patient is feeling. I'm also going to make sure that I am aware of any respiratory depression that may occur with this medication. If that does occur, it is just an adverse effect that we need to be monitoring and intervening if there's a decreased respiratory rate of like less than 12, less than 10. Okay, and so that completes our IV medication administration.